Welcome to the Birth Squad, the podcast designed to empower birthing individuals with real insights from two Black female physicians. We're here to guide you through your health journey, one episode at a time. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijalma Bello. We are two OBGYNs and longtime best friends, and we're here to help navigate you through the world of reproductive health.
Real women, real stories, real experts, and the facts you need to know.
Tune in every other Sunday, and don't forget to like, follow, and subscribe.
Ready to join the squad? Let's get into it.
Welcome to the special episode of the Birth Squad podcast. Today's episode is a little bit shorter, offering a sneak peek into an exciting new project we are working on.
We're diving into expert insights on topics that matter most to you, like skin changes during pregnancy. In this episode, we're joined by the wonderful Dr. Bulick, a leading dermatologist and my personal skin expert. She's here to share with us her expertise on everything from acne to melasma, stretch marks, and even pregnancy hair changes.
So whether you're expecting or just curious, this episode is packed with valuable tips and advice. So let's jump right in and learn from one of the best in the field.
And stay tuned for more expert insights in our upcoming projects. Welcome back to another episode of the Birth Squad podcast. We're super excited that we have someone special to share with you. She's my own personal dermatologist, Dr. Nala Bulick. So Nala, thank you so much for being on the episode this season. And we'd love to talk to you ad nauseum, but I know you are so in high demand. So we'll kind of try to keep it brief, but provide people with some great information. So thank you and welcome to the Birth Squad.
Thank you. I'm so excited to be here.
Well, why don't we just start off by having you tell us a little bit about your background and what led you to specialize in dermatology?
Absolutely. So I am a dermatologist at USC. I work here full time and I lead a couple different programs. So I'm the founder and director of our Skin of Color and our Pigmentary Disorders program. And I started that program about 7 years ago and previously led some similar efforts when I was on the East Coast. So I'm really passionate about, dermatologic care, obviously as a dermatologist, but also, ensuring access to care for individuals as well and making sure that we have, high quality dermatology care for people of all skin colors and all backgrounds. You asked me, I think, why dermatology? Of course, I'm biased. I think it's the best field ever. OB is a close second. But, I just love so many things about the field. We take care of all ages from birth all the way to geriatrics. And then depending on what your passion is, we have all options in our field. Similar to OB, we have a medical side, a procedural side. We also have, a very intensive research side. We have a pathology side. So there's a lot there's a lot of places and spaces to make impact. For me, my big passion, I should say one of my big passions has been dermatologic care for people of color. But I'm also really passionate about women's health. I'm also really passionate about medical journalism and just making sure that credible information gets out to the public. So I love that you guys are doing this podcast and really making sure that, people can get good, high quality information from good sources.
Thank you for that. One of our questions, because, we are the Birth Squad. And so, as you know, pregnancy brings a lot of changes in the body, including the skin. So what are some of the most common skin changes that you see in pregnant women?
Great question. So, there are lots of changes that happen to your skin with pregnancy. And for people who already have pre-existing skin diseases or conditions, one of the hardest things is sometimes we don't know in which direction those conditions will go. So some people, you take a common condition like acne. Some people, their skin clears up, they get that pregnancy glow. And then some people have the opposite. Their acne flares and it's the worst it's ever been during their pregnancy. And a lot of our inflammatory and our immune-mediated conditions can be like that. I treat a lot of pigmentary disorders. Vitiligo is another one where I've had pregnant patients where sometimes they, repigment or they're very stable. And then I have others where their vitiligo spreads like crazy. In terms of common conditions, one of the really common ones I see is called melasma. And so again, I mentioned I treat a lot of pigmentary disorders. So melasma is a condition where people get brown patches on the face most commonly. And it can be super frustrating for people to deal with. And, cosmetically, people don't like it. And, there's even some studies, and we just published a study showing that there may be some association with a small percentage of women also having some thyroid abnormalities, have melasma. But Definitely, there's a hormonal component along with sun exposure, and just it's more common in women. Stretch marks are another super common issue, right? That people get. No way to predict who's going to get them, and there's no way to 100% prevent them, no matter what thing is out there telling you it can prevent your stretch marks. There is no definitive way. So those are like some of the more common things we see. And then, like I said, the run of the mill stuff, acne, eczema, dry skin, rashes that may happen. There are some specific pregnancy related rashes that don't happen to most people, but can happen. So those are some of the common things that come up.
And you talked earlier about misinformation, and you hit it right on the head with stretch marks, and that there's not always a way to prevent them. What are some common things that people can reach for or do over the counter to kind of help manage some of these common issues like acne? And you mentioned melasma and sun exposure. So can you briefly just touch on some suggestions for our listeners?
Yeah. So, I mean, I think for one, when it comes to sun protection, you want to continue to wear sunscreen during pregnancy, but make sure that it's a mineral sunscreen. So, if you're wearing a chemical sunscreen, we do recommend switching to mineral. We recommend SPF 30 or higher. And then you have to remember to reapply. It doesn't last all day. So, if you're out, you gotta, I know people always forget that part. Every 2 hours at least, gotta reapply. So, keep some in your purse and your car, wherever is accessible to you to get it when you're out. So I would say photo protection is huge, and it's especially important for those who have pigmentary conditions like melasma that I just mentioned. Those women have to be even more on top of it. General good skincare. So, just gentle skin cleansers. I think less is more when you're pregnant. Sometimes people, it's not the time to experiment. It's not the time to go do, a bunch of random cosmetic procedures. You want to just do simple things, simple cleansing, simple sunscreen, good moisturizing, and then also check before you get things done. Your wound healing is impaired when you're pregnant. So, it's not a time that you want to go get an ablative laser procedure done, for example. So I think, having a good, board certified dermatologist that you can talk to about your skin conditions, that you can get on treatments when you need. Even things like acne, you can't use all the over the counter products when you're pregnant with acne. So you don't want to be using benzoyl peroxide or salicylic acid, right? So we tend to be switching people to ingredients that are safe during pregnancy, like azelaic acid or like clindamycin, mandelic acid. There's things that are safe, but again, it can be hard to sift through that, when you're pregnant and if you're not in the medical field. So I think establishing care so that you have that reference point so that you can ask those questions and make sure that you are doing the right things and the safe things is really important.
And one of the other skin conditions you talked about was the stretch marks. And I know it's a huge concern for many expecting moms. What causes them? And is there a secret of how to prevent them or
When
reduce
I
their
find the
occurrence?
secret, I'm retiring because there's no definitive way that 100% can prevent stretch marks in all people. Now, what causes them is stretching of the skin. So, we have in our deeper layer of skin, we have our top layers, the epidermis, our deeper layers, the dermis. We have collagen and elastic fibers that are all intertwined. And when you stretch them, you actually literally are putting tensile tension on them, and the skin starts changing in those areas. And so the skin obviously wants to stay together, but it's feeling strained. And so all of those fibers are getting pulled. And so then what you see on the body are these stretch marks, which almost look like little ripples, kind of coming down. Medically, we call it atrophic skin, where it's a little bit depressed. It has a little bit of that kind of wrinkling to it. And so that's what happened. It's literally the tension from expansion of your body during pregnancy and the increased weight and just, again, movement of the abdomen that leads to them happening. Now, it doesn't happen to everybody, which doesn't seem fair. And I agree. But I think there's a genetic component that we just still haven't tapped into and discovered. And, it also depends too on how much a person gains weight, right? Some people, there's a threshold. They don't gain, any stretch marks till a certain point, and then bam, last couple of weeks of third trimester, they pop out. So, I think the threshold, I think the genetic risk is all part of it. I mean, of course, you want to moisturize your skin and take care of it. But again, that's not any cream that says if you use this, you're not going to get stretch marks. There's no one that can guarantee that. We don't have that. Now, we do have things after pregnancy when you're no longer pregnant that we can do to improve the appearance of stretch marks. So we have various procedures. We have fractionated lasers, we have radiofrequency microneedling, different things which I think can definitely help. They don't 100% make your skin brand new like it looked before, but they can definitely minimize the appearance, make it less obvious, make it for people more sort of cosmetically acceptable. And there's some data too on really diluted retinol or retinoids, I should say, again, post pregnancy, not while you're pregnant, that can sometimes help improve the appearance. So we can do some things after, not as much to prevent or during.
Very helpful information because I think it's such a hot topic and everybody's so passionate about it. So getting credible information from the source is really helpful for not just listeners, for all of us. So I wanted to shift to one of your other specialties that you focus in, or which is hair loss.
Mm.
And so we see a lot of hair changes in pregnancy, outside of pregnancy. Can you kind of talk about that a little bit and what your recommendations are for managing it?
Absolutely. So, I mean, we could have a whole episode just talking about hair, multiple episodes probably. But hair loss is so, so, so common, right? Even outside of pregnancy, just having hair loss, which medically we call alopecia. But what happens during pregnancy is the growth phase of the hair cycle extends, right? So your anagen phase goes on for longer than it normally does. So we all have three phases of our hair cycle. Anagen is the growth phase, catagen is the transitional phase, telogen is the shedding phase, right? So anagen phase is prolonged. So that's why people start getting that thicker hair during pregnancy that everybody loves and wants to hold on to. And then several months after pregnancy, usually within the 4 to 6 month period, women go through what's called telogen effluvium. And that's where you get what feels like a massive shedding of hair. And the reality is you're losing a lot of hair that you normally, your body wouldn't have held on to, right? So you're just getting it all at one time, though. And so it can feel really significant. And so that's all normal. Now, what I will say though is for some women, they can have shedding that keeps going on. After that acute 4 to 6 month period, they enter what's called a chronic telogen effluvium. For some women too, when they go through that hair loss, it can unmask sometimes other types of hair loss they had that they didn't realize they were dealing with. But then as their hair starts getting really thin, they're like, wait a minute, now I'm way past where I was before. So, I always say if you're worried, again, in that period after pregnancy when your hair is shedding and you feel like, is this more than normal? This has gone on too long, or you're having bald patches or anything that's just different outside of the norm, you want to see a dermatologist. Have your scalp looked at, have your hair looked at, and make sure that there's not anything else going on because, there are many types of alopecia. And, a lot of times people, again, don't know to come see us because although we're the skin doctors, we're also the hair doctors and the nail doctors. So, I really try to make sure people know again who to see and at what time point to see someone.
That was super helpful. Thank you for sharing that. Any last words or any advice that you would like to give our listeners when it comes to skincare, hair care, or anything related to pregnancy or postpartum?
I would say I think it's so important for everyone to have a dermatologist. I mean, I can't tell you how many people I meet who have never been to one, which blows my mind because we know everybody has a skin, hair, nail issue at some point in their life, if not multiple points in their life. And so a lot of people either don't realize when they need to come in or they try to, I think with a lot of skin and hair issues, people try to figure it out themselves, right? They try home remedies or, they try just talking to people they know and, they talk to their stylist or their friend or whoever. And, sometimes that can be enough if it's a mild or early issue. But really, when you're having a true medical issue that's not getting better, that's getting worse, you want to go see your dermatologist, see someone who's board certified. And I think it's helpful to establish that care early on so that if you do end up becoming pregnant in your life, you already have that established relationship. And so as things come up and you do experience hair, skin, and nail changes, which happen throughout life, right? Puberty, pregnancy, menopause. I mean, there are multiple time points at which we see these changes happen. You know when to get in and if there is anything concerning or that's treatable, it's done early.
Great, great information because I'll even speak for myself. I waited a really long time to see a dermatologist. But you're in so high demand that I waited a long time to see you also. But, I think it's important to also for women of color, seek out people who know what to do for our skin, our hair. And I have been to dermatologists in the past where I didn't feel comfortable bringing it up because I was like, what are you going to tell me that about my hair? You don't know anything. So I think, I just want to say thank you because having providers like you is so important and getting a second opinion. I always tell people you have the right to get a second opinion. You don't have to stick with the same provider if you don't think you're getting quality care, but definitely having someone who specializes in hair in Black women has motivated my friends and family to go see other providers for similar issues. So thank you so much.
Thank
And how can people find you? Like, how can they get more information on you and where can they get in contact with you?
Yeah, so I'm on social media. So at Skin Dr. Netta, SKINDRNADA. So that's probably the easiest way to follow me and keep up with me. And I'm on LinkedIn and Facebook and some other platforms too, but I'd say probably Instagram's probably the easiest way to connect. And I think you made a really good point. Finding someone that you're comfortable with is so important. And even if you have one bad experience, don't let that rule out an entire group of physicians. Really, ask around, and look for someone who you really find that you can connect with. And I think once you have that relationship, it just makes all the difference. And I'm thrilled that your own family and friends now are kind of seeking out care because that's really what we want. We want people to not delay care and to know how to access care.
Thank you so much again.
Thank you guys for having me and for having this amazing podcast where you're really helping get good information out there. This is so important.
Thank
Thank
you.
you.